Hi everyone, this is Dr. Anara. Some of you know me. I have been involved in teaching MBBS students and getting them the basic concepts of microbiology for past almost 5 years, both as a postgraduate and a fellow and a senior resident. And I thought it's just time to share my platform on another platform. So without much further ado, welcome to the first ever lecture. I would be covering miscellaneous bacterial bloodstream infections. I just thought that this is one of the topics that we tend to miss, because when somebody thinks of bloodstream infections, as somebody preparing for a theory exam and for competitive exams, we end up focusing more on typhoids and HIV, which I am telling you are very important, but these also become very high yield, and at times we forget even like the name of the organism when it comes to that, right? So, which without further much ado, we'll start. Introduction. Bloodstream infections, we all know, is the presence of a pathogenic microorganism such as bacteria, fungi, viruses in the bloodstream, leading to a systemic inflammatory response, which could be a potential life-threatening. So this is a general bloodstream infection definition. You can have a bloodstream infection which is, because of a GNB, gram-negative bacilli, gram-positive cocci, a parasite, a virus, right? So it's just involved, or a fungi. Any of these things could be there. Now, where it comes in zoonotic diseases. Zoonotic disease itself are the infections that are transmitted from animals to humans. And then, there could be a human-to-human transmission all over. But the basic definition stays animals and human in between transmission. Even COVID-19 was labeled as zoonotic initially, and then it became a self-sufficient cycle within the humans. So anything which is going from animals to humans, either from direct contact or environmental exposure, close contact with the animals or the fluids, their products, that becomes zoonotic. So zoonotic infections, could be pulmonary, pneumonic plague, it could be skin and soft tissue, bubonic plagues, or it could be bloodstream too. The bloodstream ones, the three important at the undergraduate level will be your Brucella species, Leptospira species, and Borrelia species. Out of this, I will just give you pre-idea that your Brucella becomes a GNB and your Leptospira Borrelia are your, if anybody remembers, your spirochetes, if you remember from general bacteriology. So they invade bloodstream and cause systemic illnesses. Now we'll start with case study. A 3-week-old male newborn. See, age group important here. Presents with fever of 3 days, poor feeding, lethargy, irritability, and vomiting. A 3-week-old, their symptoms of fever are very different from the symptoms in an adult, right? Well, how do we even know something is wrong with the baby? It's just by looking at the feeding and their general activity. Constant crying, that becomes one of the points. And now, what is a newborn 3 weeks supposed to have? Only and only breast milk, right? Unless there is some other indication, it has to be breast milk. But here, the important history that will, really guide you towards the diagnosis, both in your MCQs, whether it's in university exams or in your competitive, will be family reports giving raw milk as prasad during religious ceremony 2 weeks prior. Here you have incubation period and the source. And usually it's cow milk. Nothing political here, it's just the common cause, right? And examination reveals fever, mild jaundice, and hepatosplenomegaly. So basically, in general, it's a multi-systemic involvement. That's you are seeing here. Blood test shows anemia, leukocytosis, elevated inflammatory markers. Blood culture confirmed Brucella militensis. How do blood cultures confirm it? We will just get on to that in the first slides. This is how it will look like, the presence, right? So if you have a question, they will probably ask you, what is the most likely diagnosis? They will probably reveal it's a cow, raw milk, or just raw milk. animal. Cow or pigs are the most common animals in this, as we will discuss in the life cycle. And this is the general rule. Age group is very important here. Another age group that you see in adults will be the caretaker of these animals. We'll just get into it in a bit. So about Brucella, as I was talking about, it's a gram-negative facultative intracellular cucubacilli. Hence, it's gonna be, what would you see in the picture? So normally when we have automated blood culture positive or a conventional blood culture positive, we do a smear. And within the smear of the blood, we will see components of the blood, and then you will see the causative organism. In this one, it will be inside your WBCs. It's another hint that you get. It will be that this entire infection is involving your reticuloendothelial system. So, So non-motile, non-spore forming, slow growing. It is revealed, it is grown in culture, and it's actually, we'll just talk about it. It requires BSL-5 laboratories to grow in culture. But because of its high infectivity and its potential uses bioterrorism, but it is slow growing. So again, that means the lab diagnosis, they could be false negative if we are not incubating it, prolonging the incubation. Species: Brucella militensis, abortus, suis, canis. Usually, cows will have militensis abortus, suis. From the name, you can guess it's from pigs, and canis, cats and dogs. Epidemiology: zoonotic pathogen causing brucellosis. Endemic regions with close will be anywhere where there will be close animal-human contact. Usually, people who are involved in animal husbandry and flocks of these animals. Mediterranean, Middle East, and South Asia. Overcrowding, not proper spacing, and tropics and subtropics become your endemicity. Morphology: gram-negative cucubacilli, usually intracellular. Culture will involve enriched media. So when we are saying blood agar, it means that you can incubate the blood cultures in BHI broth, either automated or conventional, and you will require an enriched media. It is slow growing, hence you will have to incubate at least 7 days, which is usually anyways done for in routine in most of the laboratories. It is aerobic, but prefers 10% CO2 for optimal growth. You will find it in a CO2 incubator or a candle jar. Biochemical test: catalyst and oxidase positive, urease positive. Becomes a very quick identification method before your automated methods give it. Why the quick is important, you will just figure it out in a bit. Because it requires high level of biosafety level. It is highly contagious, especially to the lab workers. So we need to identify it quickly, give prophylaxis to your workers who might have been exposed. Your blood cultures should be treated very carefully, which, they might have your normal organisms like E. coli and Salmonella, but at times, yep. So anyways, pathogenesis: route of entry, ingestion of contaminated milk, dairy, right? That's what was in that case. Inhalation, and this inhalation has to be very close. So this is our direct contact with animal tissue. This will be seen more in the adult age group. And ingestion of milk, dairy, this is especially raw milk, that becomes, in a rural setting, usually for children babies who anyways don't have a good immune system. Virulence factors, there are a lot of them, but being a gram negative, the ones which you have to remember will be your lipophilic polysaccharide, but you have to remember it's less endotoxic than your usual E. coli and Salmonella, and has the ability to survive and multiply inside the macrophages. That gives it a survival benefit. As I was just talking about, that the fact that it is intracellular, seen inside WBCs, will tell you a hint that it grows in your reticuloendothelial system. It disseminates through lymphatics, bloodstream, and then localizes in liver, spleen, and bone marrow. So even in enteric fever, if you remember, the most sensitive sample is not blood, it's bone marrow. Obviously, it's not done routinely, but That is the fact here. Similarly, this one will also go and localize itself in liver, spleen, and bone marrow. This is the life cycle. So you can see there is like a multiple ways through which it can go, either from the contaminated environment. So this will be in, you know, the caretakers, the milkmen of the cows, and some places where pigs are reared there. Otherwise, you have unpasteurized raw milk, even meat. In the meat eating population, undercooked meat. This is basically what they're trying to say here in the third method, is the fact that you will have, you know, so basically the cow is having a child, and it's one of the species you must have remembered was abortus. So even in the animals it has clinical manifestation. Most of them will be death of the cattle, right? So abortions, and then there obviously is going to be a human involved in cow rearing, who will have, you know, contamination, exposure to the placenta, to the fluids, to the dead calf, and that's where your, you know, infection can come, which I meant was close contact with fluids. And your, of course, environment, you know how cows are kept, if anybody has seen, there's the spores all over, you know, there's a dust, all of them kept together. You can inhale it also. So inhalation becomes a route. Inhalation is also an important route when you have a lab culture. Here, close contact between the five, that path you're saying, close contact between human beings and their, you know, that can also become a transmission. So usually zoonotic cycles move like this. There is animal, human, and then there's a possible human to human transmission as well, but the source primarily remains the animal. Clinical features: acute brucellosis, or it's known as undulant fever, pretty standard MCQ, you know, which is undulant fever. There's another one, borrelia recurrentis, we will discuss in the next video, which causes recurrent fever. So this word undulant fever, which has been named based on the nature of fever, just undulating fever. Here, if you want to go back, step ladder fever, we all know very well, it's typhoid. So undulating fever is Brucella. Night sweats, malaise, myalgia, and headache. In child, it will actually show as, you know, lethargy, unable to feed, because, you know, the child cannot complain about your myalgias. Anyway, sorry about that. You can also have localized infection, because as I was saying, it was seeding throughout your organs, hepatosplenomegaly, your reticuloendothelial system, and obviously osteoarticular involvement, which can be there in any sepsis, but it's more common here. Arthritis, spondylitis. It's also something called chronic brucellosis, seen more commonly in adults. Low-grade fever, fatigue, weight loss becomes a differential for your tuberculosis also. So that's important. Lab diagnosis, I was going on, it requires at least BSL-3 laboratory, you know, because it's highly contagious, and specimens usually that are taken are blood, bone marrow, and infected tissue. You can have direct methods like blood cultures. BACTEC is preferred because you need a prolonged incubation period, and chances of contamination are less in BACTEC. Conventional, okay, this is a very important question that traditional examiners would like to ask you. Castaneda method. So when, I think I have an image for this also, yes, it's a diphasic media. So as you can see in the above image, you have a solid phase and you have a liquid phase. This is both brain heart infusion, agar, and broth. Enriched, you all know, right? Very good media, not a basal media. So you have, what is the whole point of this is, as I said, it needs BSL-3 lab, and we did not always have BACTEC systems. We still don't have it in a lot of centers. What we do is, we will inoculate it and we will tilt the bottle. So the broth will come onto the surface and then we'll incubate it. If there is a growth, we have to anyways keep it at least for 5 to 7 days, if you remember from the previous video, you will see the growth on slant. You won't have to open it. Opening it can cause two things: infection to you, the lab worker, or contamination into the bottle. And you can have like commensals, your skin commensals, contamination, airborne GPBs growing inside of the media, overgrowing on Brucella, which is anyways slow growing, and you will miss out on diagnosis. So contamination of the broth and cross infection to the lab worker is avoided using this diphasic media, which is known as Castanina medias. A lot of labs still have it, and it is a good method before Bactec was introduced. Obviously, Bactec system would be preferred, less contamination, less exposure. So Castanina media, of course. So what was saying was Castanina method, as we were talking about, combines both solid and liquid media in a single bottle, allowing simultaneous monitoring of both phases. This is what I talked about. You twist it around, see the growth, get it. Obviously, you can do PCR for rapid detection. A lot of combined multiplex PCR systems have it, along with other pathogens, because you need a quick diagnosis of it, and that is probably the safest way to do it. This is what I was talking about, your diphasic media. Another thing is Rose Bengal screening. That is a standard, it's done for screening, and it is done on the milk sample. And standard agglutination test, it is diagnostic. It was actually gold standard for a long while. It is still done. Very similar to, Vidal test. It is a tube agglutination method. Just obviously the antigens you are detecting will be different, and your the antibodies you'll be detecting will be different, and antigens you'll be using will be different dilutions, but the same concept of MAT and DOT will be there. The SAT you have to remember, and obviously you can do ELISA for IgM detection, but culture will remain your gold standard. Now this is what I was talking about SAT. As you can see, the dilutions, the same concept as your Vidal test. It is a tube agglutination method. That's becomes an MCQ. So, because Vidal everybody knows, so they can ask what SAT is. Again, tube agglutination method. You will be looking for a MAT, which means a positive, and a DOT, which means negative. And you will be, putting dilution once a 20, 40, 80 up to, this one goes up to 640. Vidal usually, stays till 320. So that's the difference. Treatment, it's a long-term treatment. First line will be doxycycline with the rifampicin. As we know, rifampicin is the antitubercular drug. We don't usually, use it that casually, but yes, your doxycycline. Alternative regimes will be doxycycline streptomycin, for 2 to 3 weeks, but 6 weeks standard therapy stays. If you think there could be complications like endocarditis, you might have to add ceftriaxone or gentamicin. If you just remember doxy with rifampicin. Doxy stays an important important antibiotic when we come to these atypical causes and zoonotic causes. This is about it. We'll study about the next case in the next video. I don't want to keep videos too long. I hope you like it. And it was comprehensive. Please let me know if you need any more revisions, or any new videos, any topics you can suggest, or any changes I can do in my approach. Let me introduce you to my team a little, just to keep your interest going. This is our CEO. If you can see her, that's Drizzle. She's part of the perfect microbiology group. So your Brucella, why am I showing her? So that you remember it is a zoonotic disease, right? Not by cats, by cattle though, right? She's our main head of our team. We'll be introducing you to the rest of the team later. So if you keep on attending the lectures, you'll get a treat in the end in form of a cat. Anyways, so this is about it. We'll go about the next organism in the next video, which will be part of the second part of the zoonotic bloodstream infections. Thank you.